Hi, my name is Luis Marquez, and I'm going to talk about a randomized trial of hyperimmune globulins to prevent congenital cytomegalovirus. Definition: Cytomegalovirus is a common virus and primary cytomegalovirus infection that developed in a woman during pregnancy confers the highest risk of congenital infection and disease. Symptoms: Some people can flu-like symptoms the first time they get cytomegalovirus, including a high temperature, aching muscle, tiredness, skin rash, feeling sepsis, sore throats, swollen glands. In the next videos,
Congenital cytomegalovirus infection is the infection of a fetus with cytomegalovirus, or CMV, during intrauterine life. CMV is among the most common infections that cause defects during fetal development. It is often grouped with other bacteria, parasites, and viruses that cause similar illnesses in the newborn, known under the acronym TORCH, which includes toxoplasma, other pathogens, usually syphilis, rubella, cytomegalovirus, and herpes simplex virus. CMV belongs to the herpes viridae family of viruses. Herpes viruses are double-stranded DNA viruses which are surrounded by a lipid envelope. CMV is usually transmitted through contact with blood and other bodily fluids like breast milk, saliva, genital secretions, and urine of an infected person, or from transplanted organs.
application in the medicine. We evaluate the efficacy of hyperimmune globulins in phase 2 randomized placebo-controlled double-blind study. A total of 124 pregnant women with primary cytomegalovirus infection at 5 to 26 weeks of gestations were randomly assigned within sick kids after the presumed onset of infection to rest hyperimmune globulin or placebo every 4 weeks until 36 weeks of gestation or until detection of cytomegalovirus in near-these fluids. In the next videos,
Hello, Dr. Adam. How are you?
Hello, Dr. Laura. I am fine.
I want to ask you about congenital cytomegalovirus infection.
According to clinical manifestations of congenital cytomegalovirus infection, there is two presentations. The first presentation is early presented with acute fulminant infection involving multiple organs like petechia, jaundice, hepatosplenomegaly.
And the second presentation.
The second presentation is early presented without life-threatening complications as microcephaly and intracranial calcifications, especially periventricular. Sensory neural hearing loss is the most common sequela after the two presentations.
What is the investigations I should do to diagnose congenital cytomegalovirus infection?
Viral cultures in body fluids, oral secretions or urine, in the first 3 weeks of life. After 3 weeks, the infant may have acquired the organism at the time of delivery or postnatally via breast milk. Test cord or infant's blood for cytomegalovirus detection by PCR. Cytomegalovirus, immunoglobulin G, and immunoglobulin M are of limited usefulness. But negative titers in maternal and infant sera are sufficient to exclude congenital cytomegalovirus.
pros and cons. Pros: Administration of cytomegalovirus specifies Hyperimmune globulin to pregnant women with primary cytomegalovirus infection significantly reduce the rate of intrauterine transmissions and reduce the risk of congenital disease. Cause overall obstetrical complications, printer delivery, preeclampsia, fetal growth restrictions in the next videos.
Most congenital CMV infections are asymptomatic or silent, with only 1 in 10 infected infants showing symptoms at birth. The most common clinical manifestations include petechiae, which is tiny purple, red, or brown spots on the skin, jaundice, when the skin, whites of the eyes, and mucous membranes turn yellow, hepatosplenomegaly, which is enlarged liver and spleen, and microcephaly, or an abnormally small head size due to an underdeveloped brain. The hallmark feature of congenital CMV is progressive, permanent sensory neural hearing loss, or deafness, which can present at birth or develop later in life. Congenital CMV is also associated with eye abnormalities such as chorioretinitis, or inflammation of the choroid and retina, strabismus, or muscle imbalance of the eyes, or cortical vision impairment. CMV also can cause intellectual disability, developmental delays, behavioral disorders, motor disabilities, and seizures.
Issue employed in Ecuador. In Ecuador, there was intrauterine transmissions in 37% of the cases. Congenital infection was diagnosed cause antenatally in 40% of infested fetuses and postnatally in 60% of fetus. Prevention. A way to prevent congenital cytomegalovirus pregnant control is important in pregnant women who should be vaccinated. In the case of not vaccinated, IgG and IgMs tests should be performed to begin treatment. Thank you.